Hi, welcome back. Today I'm going to talk about scoliosis. I want to put a wee disclaimer in here because I've took this information from my knowledge with it, other people's experiences and a few things, some websites. I'm not a doctor, so if you think any of this is wrong, sorry. I'm going to explain what it is, the different types of it, causes, how to check if you have it, the symptoms and the different treatments you can get. Well, first of all, what is scoliosis? It's essentially an abnormal curvature of the spine. Usually, if you can see from this photograph, there is a natural curve to the spine. Like from the side profile you'd be able to see, but with scoliosis it's an abnormal curvature, so it can curve from left and or right, as you can see from this photo. It can happen to anyone at any age, but it usually does occur between the ages of 10 and about 15 to 18, depending on when you stop growing. It can cause other complications. So when the spine is curved that way, it can start twisting your rib cage, depending on the size of your curve. So there are about 7 different types of scoliosis. The first one is congenital, which occurs at birth or before birth, just while the baby is growing and developing within the womb. There is early onset, which would happen between the ages of 0 and 10. Then you have adolescent idiopathic, which happens between the ages of 10 and 15 to 18, depending on when you stop growing. That is the most common type. Then you have degenerative, can't say that word, which happens when you're older, which can occur through just normal old age and wear and tear. Then we have neuromuscular, which is usually caused by a neurological or a muscular condition. Then we have syndromic, which would be caused if a person has a certain type of syndrome. And then the final one is kyphosis or Schumann's kyphosis. Now that one is when the top part of the spine is curved over more, so it's more like hunchback. For me, I had adolescent idiopathic and kyphosis, but more about me later. So there are a few different ways that you can check to see if you have it or if someone else has it, and these are just the signs/symptoms. So if you have a look at this picture, if shoulders are uneven and or the hips are uneven, if you lean to one side, your shoulder or your hip could be sticking out. Your clothes don't fit well just due to like the different slopes in your shoulders and your hips. If it's severe enough, you can visibly see the curvature in the spine, and of course there's always pain, but if you go to see the doctor, sometimes they tell you that it shouldn't be painful. So the easiest way to check is to get someone to check for you. If you just stand still and someone looks at your back, I'll show you with my photo here. So if you lean forward and you can see the shoulder, one shoulder or one hip poking out like this, or again just look at the shoulder height and the hips if they're uneven. So there are different treatments. If you think you have it, then go down and see your GP or your own doctor. He will examine you and then refer you for an x-ray. They will have a look at that, and the next stage you would go for an MRI scan just so they can have a more clear picture of what's actually going on. Once you have your MRI, then you will be referred to a specialist. They will examine the degree of the curvature and talk to you about it a bit more and go through all the different treatment options that you can receive. Usually if you find out you have it from an early age, then what they will do, if it's not that severe, they'll examine it every 6 months until you stop growing or you're the age of 18, and then you will start going once a year. So what they do, they measure the degrees of the curve, and that's how they can determine how serious it is. You can have one curve or 2 curves. Me myself, I have 2 curves, so one was going one way and one was going the other way. The first sort of treatment option where your curve is between 0 and 25 degrees. They don't tend to do a lot, they just tend to keep an eye on it. If it's over 25 degrees and you're still growing, sometimes what they'll do is they'll put you in a brace just to hold it in place to prevent further movement while you're still growing and your spine's still stretching and growing, so it doesn't have the opportunity to curve any further. And because I had two curvatures, one going one way and one going the other way, they wouldn't give me the brace because it wouldn't make any sense for me personally, but they have done it a lot. What's really cute for kids, there is a website, I'll link their Instagram and everything down below, but they're called Higgy Bears. So what they will do is they will match the colour of your brace and put a brace on a teddy bear. I think that's really cute and it helps kids a lot, especially at that age, because you're terrified, you don't know what the hell's going on. And that's part of the reason I'm doing this video, is because there's not a lot out there. It's all the medical stuff, and there are groups and everything. There's some great groups, I'll link them down below as well, but there's not a lot of personal experience out there where someone's just sitting one-to-one telling you how it is, and it's really scary for the kids and for parents alike, or for adult or any age that you get it at. So I think it's really important that we do talk about it more, because I guarantee you, once you find out about this, you will find a lot of people with it. Once your curve is over 40 degrees, then that's severe. So they will start looking at surgeries. I will get into my experience after, because mine is a wee bit complicated, but it's called spinal fusion surgery. So what they do is they attach a rod to your spine and just put screws in the whole way down, wherever it needs to be. If you're still growing but you need the surgery, then what they'll do, there's a new type of rod that extends. I don't know if you go in and get it extended or it just extends. I'm honestly not sure, but I'll leave links down below. I'll give you all that information. It can be painful, but people can manage it. It just depends on how severe your curve is and how you can deal with it. When people first find out that they've got it or their child has it, they start freaking out. That's just what everyone's brain does. You start thinking about what you could have done to prevent it, what you could have done to make sure this doesn't happen, and then you start blaming yourself. You've done nothing wrong. It's not caused by heavy lifting or twisting the wrong way or doing something, or it's not caused by anything that happens during pregnancy. It's not. Now, it can be genetic. Like, there is some causes. If you get it when you're an adult or you have another underlying condition, then that's explainable. But most cases of scoliosis, the causes are unknown. They don't know what causes it. It just sort of happens. So living with scoliosis, it can be challenging, especially when you don't know what's happening. You might start freaking out and stop doing things that you love, like sports or dance or anything that involves you standing too long or having a lot of activity, but keep doing what you love. There's no point in stopping and feeling really sorry for yourself. Like, I didn't push myself to do things that I wanted to do and that I loved because I was too scared. It is actually recommended that you keep a fit enough lifestyle because it will prevent from more wear and tear, and it will actually help your muscles become stronger. Because of the way the curve goes out, it can like spread your muscles apart so far on one side but like really squish in on the other because the curve is pushing against it, or making that muscle stronger, even if it's just going for a walk every day or just even something simple. It doesn't have to, I'm not saying go and body lift and all that crap. I'm not saying that. I'm just saying do it. Exercise makes you happy, and don't let the scoliosis stand in your way because it's just going to make it worse, and it'll make you feel worse about yourself. Now, the pain's different for everyone, but for me it was very painful. I could barely move some days. I could hardly get up out of bed some days because the pain was so severe, and I took all different pain medication. But there are also different ways it can help. There's loads of pain management. Like the TENS machine was amazing. That was really good. That really helped my muscles. Massages are great. There's so much different stuff you can use if you don't want to take medication. The biggest concern people have with it, especially women, they're afraid they're not going to be able to have kids. Now, if you have scoliosis or have had spinal fusion surgery, you have the same chance as any other woman out there to be able to have kids and deliver them healthy and normal. The really big issue with scoliosis, it takes a really big toll on your mental health. Really big. Well, for me it did anyway. You can start hating how you look because clothes don't fit you properly. There's some things you just can't do because it is too painful, and you'll learn yourself. You just need to listen to your body for that. There are so much support groups out there, and again, I will link them below because it's so terrifying when you don't know any of this. I didn't know nothing. So now all that the technical stuff is all out of the way, I'll share my experience with you. I found out I had scoliosis when I was 12. What had happened was, one Easter my little cousin was born, and I was holding him and I was getting a really weird pain in my hip down here, just like around my back into my hip, and it was like a pain I'd never felt before, and I'd said to my mum about it. And then when we were driving home, I needed a pillow for my back because I just couldn't even sit in the car whenever I was changing into my pajamas. But I had these like slide wardrobe things with big mirrors on them, so it was like floor to ceiling, and I bent down to get something off the floor and I couldn't see that my back wasn't, I looked in the reflection, I could see there was something not right there. It was kind of just bumpy a bit, so I got my mum to look at it. So she brought me down to the doctor's. So I went in and explained how I was feeling and stuff, and he said, "Oh, Niamh, you're fine, you've probably just pulled a muscle or something." So my mum went, schmizzing, she just went, "No, you look at her back right now, because this is not normal and this is not just a muscle spasm." So she'd like put it up and showed him, and he just sat back down. "Oh, alright, okay, I'll refer you to an x-ray." So then got my x-ray, got my MRI, went and spoke to the specialist. So at the start, I can't really remember what the degrees of the curves were. It was in the 20s anyway. The one at the top was going right and the one at the bottom was going left, so I had two curves. I also had kyphosis, well I still technically have kyphosis, I think. So a few years and all had gone past, and had been going for regular checkups and everything. And then it came to when I was 18, they were going to discharge me, but I was in so much pain I couldn't handle it, and I wanted to keep getting checked because I just wasn't happy. They were reluctant to give me surgery, even though by this point, might I add, one curve was 45 degrees and one was 55 degrees. Reluctant to give me surgery. Oh, also, side note, the consultant decided to tell me, "Oh, that shouldn't cause you pain." I'm sorry. I freaked out because I thought my mummy was gonna think that I was lying and trying to get out of things. No, she believed me, so it was okay. Like, I was shocked. The severity for severe scoliosis is 40 degrees, and I've researched this, and you're telling me 45 and 55 degrees shouldn't cause you pain. Even though my rib cage was twisted, digging into my lungs, couldn't breathe half the time because the pressure was just so much. Oh, anyway, whatever. I'm getting off track. I'm getting angry because I'm just reliving that situation, and it was not fun. So the following year, they hadn't called me back for an x-ray, and we got on the phone to the hospital and said, "No, look, you need to see her because she's in a lot of pain." So we went to see the consultant, but it was a new consultant this time, and he said the same thing. They were reluctant to give me the surgery because I evened out. Yeah, evened out. So if I really wanted the surgery, it would be my own choice, and I would have to say that it was for cosmetic reasons. To be fair, my mental health was really bad at the time because I couldn't deal with the look of it. I hated the look of it. It was horrible, and I wanted rid of it. I had started speaking to people who had the surgery and never looked back. Some people didn't do great with the surgery. I looked at all my options. He told me to go out and think about it for a year and then come back to him. So that's what I did. I went away, thought about it for a year, and decided I want it, I'm getting it. So when I was 20, I went back to him and decided, yeah, I want the surgery, and it's for cosmetic reasons. That is what I officially had to say, that it was for cosmetic reasons. Even if it relieved some pain, even though they told me it would have relieved no pain because I shouldn't have pain, even if it relieved some pain, I didn't care. I wanted it, I had my heart set on it, and I was going to do it. No one was going to tell me otherwise. He then told me that the waiting list was 2 years because there's only 4 surgeons in Belfast that do this type of surgery. A couple of months go by and I get a phone call. They can send me, my mum and dad over to London to get the surgery in 2 months. So in January 2016, I went to London and had my surgery, and I haven't looked back. My pain has significantly significantly decreased. Right, this is my own personal experience and it's not going to be the same for everyone, but I'm just sharing my experience with it here. So pain's decreased, don't need to take as much pain medication. I love my scar. Everyone was giving me all these different stuff that would reduce the scar and I refused to put them on. I got taller. I was 5 foot nothing and I'm 5'1". It made me really happy. That's really sad. I was so happy. I was so happy. I think that's about it. If you have any questions at all about it, just leave a comment and I will happily get back to you. If you liked this video, please give it a big thumbs up and share it with people who have scoliosis or have just found out they have scoliosis, because it's really terrifying, and if I can help ease someone's mind out there, that would be perfect. As I said before, I will leave a few links down below so that you can get in contact with some groups or look at more information that I haven't covered, or anything that you're just concerned about or anything that might be useful. It will all be in the description box, and I will see you in next week's video.